Chyawanprash has been used for thousands of years. It's frequently taken as a dietary supplement, and it's one of the most popular remedies in Ayurvedic medicine. It's a herbal jam-like medicine, and it's used in Ayurveda, a system of traditional medicine from India. It's traditionally used as a health supplement to fight everyday illness and to support the immune system. One of the most popular Ayurvedic medicines, the Chyawanprash, falls under the category of drugs named Rashiana, which are rejuvenating tonics that aim to maintain the youth and to delay the aging process. The Chyawanprash is most commonly used to boost the immune system, to treat any lung or breathing problems, and to improve memory and brain function. Chyawanprash is typically composed of about 50 different herbs, though the composition can vary between 25 and 80 herbs, depending on the manufacturer. However, the main ingredient, amla, the Indian gooseberry, remains consistent across the different formulations. According to official recipes, the amount of Indian gooseberry used is over 100 times the amount of each of the other herbs. There's 44 standard herbs in Chyawanprash, according to the Ayurvedic Pharmacopoeia of India. For some, only the Sanskrit names are available, though the scientific name has been determined for others. To distinguish the Chyawanprash from competitors, some companies add metals such as gold and silver to their formulation. Indian gooseberry is very high in vitamin C. Since the Indian gooseberry is the main component of the Chyawanprash, the high vitamin C content is likely responsible for some of its antioxidant properties and its other effects. The Indian gooseberry and the vitamin C have both been shown to enhance memory, and this could be how the Chyawanprash can exert its improvement on the brain function and the memory. Brain degeneration disorders like dementia and Alzheimer's disease are thought to be partially caused by decreases in cholinergic neurons, a certain type of brain cell. The Chyawanprash may improve the brain function by enhancing the activity of these brain cells. Smoking can cause a variety of symptoms, including coughing in the morning, persistent phlegm, and breathlessness after exercise. Chyawanprash at 12 grams twice a day improved the symptoms and it increased the quality of life in a clinical trial with 50 smokers. Tobacco smoke can also damage the DNA, increasing the risk of mutations and potentially leading to cancer and other diseases. Another study of 25 male smokers found 20 grams twice a day of Chyawanprash reduced the DNA damage from smoking. Chewing tobacco, which acts similarly to tobacco smoke, is one of the leading causes of cancer in India. In a clinical trial on 21 people, 20 grams of Chyawanprash twice a day, along with quitting the chewing tobacco, reduced the incidence of cancer and the toxic effects of tobacco. A clinical trial in over 600 children found that Chyawanprash, 6 grams once a day, reduced illness frequency from infections and allergies, and it improved energy levels, physical fitness, strength, and stamina. In cell studies, the Chyawanprash increased the activity of different cells in the immune system and the release of cytokines, the molecules involved in activating the immune system. In a clinical trial of 90 people, Chyawanprash at 10 grams twice a day, given with anti-tuberculosis drugs, eliminated the symptoms such as coughing, weakness and loss of appetite and weight. It also reduced the recovery time. When it was taken as an add-on to conventional drugs, it reduced inflammation and other symptoms in a study on 99 people with tuberculosis. It also improved the uptake of these anti-tuberculosis drugs. 2 clinical studies using the Chyawanprash in combination with conventional anti-tuberculosis drugs cannot be considered sufficient evidence to back up its effects, though. In a clinical trial with 128 college students, Chyawanprash at 15 grams twice a day improved alertness, attention, concentration, and academic performance. Some mouse studies found that daily Chyawanprash supplementation improved memory in aged mice, more so than in young mice. There was also generally improved brain function, possibly due to the Chyawanprash's antioxidant properties. It might also improve brain function by enhancing the activity of a certain type of brain cell cholinergic neurons. A clinical trial of 75 people with head and neck cancer showed Chyawanprash 10 grams twice a day, given during radiation therapy, reduced the side effects. People were given either Chyawanprash and vitamin supplements, or vitamin supplements alone. The group given the Chyawanprash showed improved skin and mucosal reaction. In mice, the Chyawanprash administration prevented kidney damage caused by anti-cancer drug cisplantin and heart damage caused by doxorubicin. A clinical trial with 60 people showed 10 grams twice a day of Chyawanprash reduced depression as was measured by a depression rating scale. An increased erythrocyte sedimentation rate, or ESR, is a marker of inflammation, severe infection, and pregnancy. A large teaspoon of Chyawanprash twice a day decreased the ESR in a study of 40 children with throat infections. Antioxidants are substances, and they can prevent cell damage from oxidative stress. Vitamin C is one of the most effective and frequently taken antioxidants. A clinical study of 12 men found that Chyawanprash is more powerful an antioxidant than vitamin C. Several animal studies have demonstrated that the antioxidant property of Chyawanprash could reduce heart, kidney, and liver damage. In a study with 9 people, 25 grams twice a day of Chyawanprash reduced the level of molecules that are associated with aging, such as urine nitrogen content. A mouse study found that Chyawanprash could reduce skin damage from UV exposure. Cell studies with human skin cells showed that Chyawanprash increased cell growth, and it helped reduce levels of reactive oxygen species, a molecule that's involved in oxidative damage and aging. As was the case for oxidative damage, the evidence regarding Chyawanprash and anti-aging is still insufficient, and further clinical trials would be required. In a clinical trial on 10 healthy people, Chyawanprash at 15 grams once a day helped to reduce cholesterol levels. Studies on rats and mice show that Chyawanprash given before an allergic reaction can reduce the symptoms comparable to cetirizine, a common anti-allergy drug. For the most part, there's few reported side effects from taking Chyawanprash. Most clinical studies didn't find any negative effects or toxicity. Those with diabetes should take caution when taking Chyawanprash due to its high sugar content from the added, unrefined cane sugar and honey. Due to the lack of safety data, pregnant women should consult a doctor before taking Chyawanprash as a supplement. Some sources online recommend reducing the dose by half for pregnant women, though no scientific studies have examined this in detail. Some reviews mention sensations of heat after consuming Chyawanprash, likely due to the strong combination of herbs in Chyawanprash. There's no reported drug interactions with the Chyawanprash. However, it's still recommended to consult a doctor if you're taking it in combination with medications. Chyawanprash is a dark brown jam-like paste. It's usually eaten directly or taken with warm milk or water. Because it's not approved by the FDA for any condition, there's no official dose. Users and manufacturers have established unofficial doses. A typical dose could be 1 teaspoon, or from 10 to 15 grams twice a day. For more on herbs, supplements, and natural treatment plans, check out my website.